If you or someone you know has been experiencing bleeding from the vagina, please stick around. You need to hear this. Vaginal bleeding is something many women experience at some point in their lives, but it can sometimes signal an underlying issue. Today we're diving into the key factors that can cause vaginal bleeding, so you can have some knowledge of what is happening down there. But remember to save or share this video with someone who needs to watch this. Let's get started. Vaginal bleeding is often tied to the menstrual cycle, but when it happens outside of your period or feels unusual, it's worth paying attention to. So, what are the factors that can lead to vaginal bleeding? Let's break it down. First, let's talk about normal causes. Menstruation is the most common reason for vaginal bleeding, typically occurring every 21 to 35 days for most women, but other natural factors can play a role too. Such factors can include 1. Hormonal changes. Puberty, perimenopause, or even stress can disrupt your cycle, leading to spotting or heavier bleeding. Another factor is ovulation. Some women experience light bleeding mid-cycle when an egg is released. And lastly, pregnancy. Early pregnancy can cause implantation bleeding, a light spotting that happens when a fertilized egg attaches to the uterine lining. These causes are often harmless, but if bleeding feels excessive or irregular, it's time to check in with a healthcare provider. Now let's explore medical conditions that can lead to vaginal bleeding. These are important to recognize because early detection can make a big difference. Number 1. Fibroids or polyps. Non-cancerous growths in the uterus can cause heavy or irregular bleeding. Number 2 is endometriosis. When tissue similar to the uterine lining grows outside the uterus, it can lead to painful heavy periods or spotting between cycles. The third medical condition that can lead to vaginal bleeding is polycystic ovary syndrome. Hormonal imbalances from this condition can cause irregular or heavy bleeding. And number 4, infections. Pelvic inflammatory disease or vaginal infections can sometimes cause bleeding, often paired with other symptoms like pain or discharge. The point is, these conditions often have other signs, like pelvic pain or changes in your cycle. If something feels off, don't ignore it. Talk to your doctor as soon as possible. Again, let's delve into the serious concerns. Some causes of vaginal bleeding require urgent attention. While they are rare, it's critical to understand. The first concern is ectopic pregnancy. Bleeding with severe abdominal pain could signal a pregnancy developing outside the uterus, which is a medical emergency. Miscarriage is also a serious concern. Heavy bleeding with cramping in early pregnancy may indicate a miscarriage and needs immediate medical care. And finally, cervical or uterine cancer. Abnormal bleeding, especially after menopause, could be a sign of something more serious, like cervical or uterine cancer. These three conditions are less common, but they're why any unusual bleeding, especially heavy, persistent, or postmenopausal bleeding, should prompt a visit to your healthcare provider. Lastly, did you know that lifestyle and external factors can also play a role? Let's take a look. The first point is medications. Birth control pills, intrauterine device, IUDs, or blood thinners can sometimes cause spotting or heavier bleeding. Stress can also cause bleeding. High stress levels can disrupt hormones, leading to irregular bleeding. And 3, trauma or injury. Physical trauma, like an injury to the vaginal area, can cause bleeding and needs medical evaluation. You need to know that changes in your routine or medications can sometimes explain unexpected bleeding, but always consult a professional to rule out other causes. The bottom line is, vaginal bleeding can have many causes, some normal, some serious, but your knowledge about it gives you strength. Pay attention to your body, track any changes, and don't hesitate to reach out to a healthcare provider if something feels unusual. Your health matters, and you deserve answers. If you want to learn more about women's health, subscribe to this channel for more videos and share this with someone who might need it. Stay safe. I will see you next time.